Hello and welcome to Triage, timely conversations for healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello and welcome to our Triage 2021 Healthcare Outlook. I'm Richard Church. I'm here with Mary Beth Johnston. We co-lead the K&L Gates Global Healthcare and FDA practice. And as we start off 2021, after what can only be said was a remarkable 2020, one thing we're doing with Triage is looking to take a little bit more conversational tone and interview some of our internal experts on various topics, but even in some instance, maybe external experts that we may bring on and do something a little bit more conversational than Triage has been to date. So with that, let Mary Beth say hello, and then we'll get started on our conversation about what we're looking for in 2021 and the healthcare outlook.
Thanks, Rich. It's a pleasure to be here. And I do think that coming off of 2020, 2021 is going to be also a fascinating year in the healthcare industry. And, as healthcare lawyers, I think there's a lot to look forward to. So why don't you start us off today and talk a little bit about where we are with COVID and implications for the regulatory regime?
Yeah, thank you, Mary Beth. And, it's really been interesting, and we've just been really fortunate to work alongside so many of our healthcare clients across the country as they have managed on the front line the pandemic. And we've seen this, sort of wave of issues that would all hit for different clients at different points as surges happen in different parts of the country. It seems like where we are now, obviously the trends are looking good at the moment that we're recording. And I think most clients have really managed through most of the really challenging surge issues. So the focus of a lot of the questions we get right now are really about vaccine rollout. And obviously, there were a lot of privacy issues to resolve and a lot of issues as we first rolled those through the healthcare workforce, as well as the extremely elderly population. But now as we move into a broader scale vaccine, we expect to continue to, ask and answer a lot of questions about how to equitably manage and just efficiently manage all of the quite unique challenges of really a national vaccine campaign at a speed that we've never seen before in this country. The other main COVID topic that I think will continue to take a lot of time and effort is the wrap up of the CARES Act funding and the provider relief funds. As most folks are aware, healthcare providers received substantial amounts of money through the provider relief funds. Those came with substantial terms and conditions that included a reporting obligation. The initial report was due at the start of this year, but was delayed in conjunction with a lot of the transition issues between the two administrations. And so we do expect probably some further guidance on final reporting, and then, clients will have to really make some final decisions about how to report the funds they received, what they use those funds for, and potentially whether there's even a repayment obligation at some point along the line after HHS has looked at those reports and determined if the funds can be justified and retained. So that's, I think actually Mary Beth then dovetails us really well into our next topic, which is, sort of your outlook for the fraud and abuse front in 2021.
Yeah, I do think that the message that we're hearing from current government officials and those that are now departing their positions, given the change in administration, is that there really is a large pent-up demand, meaning that during COVID, there just wasn't the resources and certainly not necessarily the priority with respect to moving ahead with, certain False Claims Act cases. So I think, given that you're changing from a Republican administration to a Democratic administration, and if stereotypes fit, right, where if people believe that there's more aggressive enforcement when the Democrats are in charge, then we would expect, I think, there to be an escalation of certain types of cases. We've seen a lot of cases over the last couple of years where they were sort of nationwide sting operations. And a lot of times that doesn't really involve the client base that we represent, which are, hospital health systems, academic medical centers. But I do think that there's a likelihood that there'll be more cases that affect the bread and butter parts of the healthcare ecosystem. In 2020, there was, around $2.2 billion in recoveries, and that was a lot less than 2019, I think by about $1 billion. Still, the overwhelming amount of those recoveries are in the healthcare industry. And interestingly enough, it stays true to form that those recoveries are coming from suits from qui tam relators. And so I don't think there's going to be any change in that. So I think in 2021, you're going to see probably an increase in government instituted cases, as well as the same degree of whistleblower cases. The other interesting thing, you mentioned that in your first comments, while the government said early on in the pandemic that for, foot faults that occurred with respect to receiving some of the CARES Act money or other provider relief money, that wasn't going to be the source of a false claims action. And so everybody appreciated that and took heart in that. But I also know that over time, people often have a tendency to forget those kinds of things, especially when even the most innocent of mistakes result in very large payments that were inappropriate. And so I do worry, and I know you and I have argued about this a little bit, about whether there's vulnerability for healthcare providers in the types of money that was received that required an attestation, and whether that just makes it much easier for the government to bring a case. And so I don't know. I'm hoping that won't be a focus of anything, given that we're not out of the COVID woods. But I do think it'll be an interesting thing to watch. The other thing that I would mention, because I'm a longtime healthcare regulatory lawyer, I was waiting to see what would happen with Stark and whether those new flexible regulations would actually get finalized before the end of the Trump administration. And of course, they did issue those regs, and they were largely consistent with some, I think, helpful changes from the proposed rule. And so I do think the value-based purchasing flexibility that's provided, in addition to the regular kinds of stark issues that we face with physician financial relationships, I think the rule really provides some interesting and fascinating changes that will make it easier to contract. Now, I know we were all worried a little bit about the fact about the rules being in effect. And recently, CMS has come out with a statement that you can rely on the new finalized Stark rules. I would hasten to note, however, that President Biden's nominees for HHS and for CMS have not been subject to confirmation hearings or confirmed. And so maybe there's a change there. And of course, we haven't heard anything from the OIG or HHS about the new anti-kickback statute rule changes. But I would not expect that to be the kind of rules that would really be, changed in a big way, even if the Biden administration wants to look at it more closely. And I do think that there's an interesting idea and topic that I think you can address is, now that we are in a Biden administration, what will that mean for the Affordable Care Act, and whether providers can look to a potential return to what felt like more funds for folks by decreasing the number of uninsureds.
Yeah, I think the Affordable Care Act will be obviously a topic we're all watching very carefully. Obviously, we come into the year with a Supreme Court decision still pending on whether the entire Affordable Care Act is invalid as a result of the pace out of Texas. Now, we've obviously reported on this already. I think anyone who watched those oral arguments, and conventional wisdom is that that's about as badly as oral arguments could go if you were hoping for the Affordable Care Act to be overturned in its entirety. But obviously that question is still outstanding. It was interesting, within a few days of the Biden administration coming in, they obviously reversed course and just said essentially, no, never mind about all the briefs that the federal government had filed in that case to date, indicating that they thought the law should be struck down. So obviously, we anticipate the law will not be struck down in its entirety, but we are still watching carefully for that final decision to come out from the Supreme Court. More importantly, I think what you're alluding to, Mary Beth, is obviously, while the Affordable Care Act was in place for the last 4 years, it was with an administration that was pretty skeptical of that law and did a number of things to probably try to minimize its ability to be successful and to expand care and coverage at the level it was intended. So you really have now the Biden administration coming in and likely to do everything possible to really maximize the benefit of the law and its availability to folks, as well as potentially try to work with a very slim margin in the Senate to try to advance some key changes and improvements to the law. So we do expect a lot will happen there. Obviously, Javier Becerra was a key member of Congress when the law was passed. The new CMS director, she was very instrumental in understanding the law and implementing the law in her role at the time. So assuming all those folks are approved through the nomination process, we would expect a lot to be done to restore the law. As we look at those issues, and I think related to those issues, we'll see a real focus on mental health, which is, again, a COVID issue, probably a broader than COVID issue, but mental health parity and just the need for mental health in this year, I think will be a key topic as you're looking at expanded access to healthcare. Similarly, I think, social determinants of health has really become a key topic that folks are really digging in on and understanding that it's not only now about if you're going to be successful in managing healthcare populations, it's not even about the healthcare itself, but the underlying issues of food insecurity, housing insecurity, folks that are in situations that are not safe from domestic violence or otherwise, that are really driving a lot of negative health outcomes. And so if we're going to be successful in reducing healthcare costs and really achieving value-based goals, we'll see a lot of activity there. And I think along those same lines, obviously, 2020 was a really noteworthy year as our country really focused on fundamental inequalities that have remained within all of our society, but particularly within healthcare, and the dramatically different outcomes and risk levels that folks may face based on their racial background is of significance. And so we do expect that we'll see as the Biden administration works on ACA more broadly, but on its health agenda more broadly, that addressing these health inequalities is going to be a key topic that all healthcare providers should be alert to and obviously would want to be working toward correcting. With that, Mary Beth, let's shift topics again, although almost all of this is impacted significantly by COVID, but healthcare consolidation continues to be a big topic, and the deal flow, while certainly restricted in 2020, ultimately was still, a significant year for deals in 2021, likely, again, another story of pent-up demand, back to your key theme.
Well, if you believe industry experts, I think you're exactly right that they expect that what we're seeing going into 2021 is that deal volume is going to continue to go up. I mean, what we saw in 2020 is that there was pretty much a halt, depending upon the industry sector that you were in, that deals, did stop in the second quarter of 2020. But it didn't take very long. The freeze began to thaw in 2020. And, by the end of the year, there really was a significant rebound. And I do think that in part, there were a lot of reasons for that. One you mentioned is that COVID, I think, is driving consolidation. I think that what's going to be interesting is to see, is that in 2021, is there going to be a continual drive of hospital consolidation, or whether it's going to be in other industry sectors. Some of the bright spots, I think, in 2021 is, if you're in private equity, I think there'll be a number of opportunities. Some of the hardest hit healthcare sectors certainly were in physician practices. And of course, there are physician practices and certain subspecialty expertise that has remained somewhat independent from health system acquisition. So liquidity is important. And if you've got funds to spend on, I think, physician practice acquisitions, you're going to see a lot of consolidation in those markets, whether it's dermatology, whether it's in radiology, in other kinds of subspecialty expertise. I think there's going to be a lot of opportunity. The other thing that I guess I would say is there may be some interesting changes that are going to occur in just the way the deals work, because while we are hoping that COVID is going away and, while we're all looking forward to that day, it's going to impact the way deals are done. One thing that you'll hear in the industry is the COVID exclusion in representation and warranty insurance, and how you can push back on making that just not absorb and exclude all the risk in a particular deal. There's also, I think, going to be a COVID impact on valuations and how you look back at a trailing 12-month period and, whether there's a way to not sort of devalue the business just because of the timing of it in light of it being on the heels of a pandemic. So I think that the only thing that might cool potentially a continuing consolidation is, again, the fact that you have a different group of people in the White House and a different group of folks who care about, antitrust regulation. And there's already been a number of comments said by the folks in that space, both by the president and the vice president in historical comments that seem to suggest they have a focus on protecting consumers and therefore patients and what that means in terms of a continual consolidation pattern. So we'll see. I think there's a lot to be optimistic, particularly on the deal front. And it does dovetail nicely, I think, with some of the regulatory flexibility that we're seeing as well. Because in the end, depending upon the type of the transaction that you were working on, some of the types of risk that we would worry about in a deal may actually feel a lot safer with respect to some of the stark changes and flexibility under the anti-kickback safe harbors. So I know we have some remaining time, and I know that one area near and dear to your heart, maybe we could talk about before we wrap up, is sort of interesting things that might happen in drug pricing.
Yeah, this is, and I appreciate you noting that I couldn't let this end without talking what was a tumultuous year at best in the 340B program on top of a pandemic, and then quite frankly in the middle of a pandemic, which was a little surprising. So, and the interesting thing I think, Mary Beth, about drug pricing is it's a bipartisan issue right now. The Republicans said they cared about it. Donald Trump had run strongly on impacting drug pricing, and certainly the Democrats have had their own drug pricing proposal that Nancy Pelosi had pushed forward last year. So it does seem an area where there is continuing potential for alignment, even notwithstanding the difficulties within DC among the two parties. And so we have a lot of interesting things to watch. The other thing that happened, of course, late last year is the Trump administration pushed out a number of final changes to try to really deliver on some of their drug pricing initiatives, including, an index of Medicare pricing to international pricing. Most of those efforts got stalled in the courts or through the delay in, the natural delay in any proposed rule that occurs, such as the change in the rebate rule to prohibit payment of manufacturer rebates to PBMs. So all that kind of got tied up in the courts and the transition to the Biden administration, where they're going to look at all those rules. But it's not at all clear that the Biden administration might not want to let some of those rules proceed and attempt to defend them. And, an interesting opportunity for them to say, well, this is a Republican proposal, but we think it's a good idea, so we're going to continue to push it forward. So that's, I think, definitely a topic we're going to be watching is what does the Biden administration do with what's already sitting out there in terms of, or with new legislation. And then obviously the 340B program in particular, it's really been a wild year. There's, lawsuits pending all over the country by manufacturers, by different provider groups related to the negative actions manufacturers taken related to contract pharmacy. There's a real potential for, again, legislative action there as well, but also, almost a comical number of courts looking at the same issue at the same time. And so, some order will emerge out of that chaos, but it is a pretty remarkable moment. So we'll be watching that in 2021 as well.
It's been a pleasure for us to talk today. Not like we don't talk regularly, but it's good to talk to you on the podcast. I think we probably need to get back together mid-year to see if any of the things that we thought we might see in 2021 has actually come to fruition. I'll be looking to see whether any of the things that we said today actually come to be.
Yeah, thank you, Mary Beth. And certainly, I think we can all say after 2020, this was not what we predicted for 2020. So we're all keenly aware of the danger of making these predictions. But thank you for taking the time to chat. And again, to our audience, we appreciate you listening in and look forward to continuing these conversations throughout the year on the K&L Gates Triage podcast.
Thanks again for listening to Triage, timely conversations for healthcare professionals. New episodes are available for download through Apple Podcasts, Google Podcasts, and Spotify. By subscribing to Triage, you will receive timely notifications for each new episode. Also, if you have any topics you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.